All right, so today my group and I would like to explain to you the potential benefits of chiropractic and what we have to offer for you guys. Whether you're a casual runner who likes to just get up in the morning and go for jogs, or a marathon runner who likes to train intensely and pushing yourself to your limits, chiropractic is going to keep you healthy, hopefully propel your performance to the next level. So we're going to talk about the potential benefits that us as chiropractors can have on your running performance, but most importantly, keeping you safe and healthy. So for those of you who don't know what a chiropractor does beyond the level of just cracking your neck or cracking your back, we look at your body as a whole, which involves your musculoskeletal system all the way down to your nervous system. Like I said, far more than just picking up your neck and cracking it. Like I said, ultimately we're trying to increase your range of motion in your joints to help you restore your body to normal function. Or if you're already at normal function, we just want to keep increasing that mobility, keep increasing that range of motion to help increase your running performance. So we really just want to see you reach your goals. That was according to Lefebvre et al. In 2012. So once we determine the location of what needs work, we want to do further treatment to improve that area, that specific area. So that is where the adjustment comes into play, which is correcting a subluxation. If you don't know what a subluxation is, it's where a specific spot on your spine where your spine is probably out of place, and that's where we get the adjustment to put it back. So chiropractors can do much more than just, like I said, crack your neck and back. We do all sorts of soft tissue work, which will help free up those problem areas. If you have a tight muscle, we can work it out. And it's gonna ultimately increase your running performance. And that's gonna create a greater strength in that muscle group, which plays a pivotal role in being successful. And that was according to Milstein in 2022. There's been a lot of research done to show the evidence of how chiropractic has helped runners in the past and how it's been successful in treating certain injuries. How it can even prevent those injuries from even happening.
What people don't know is that many injuries come from repeated movement within the joints and the bones, which is why runners have so many injuries since they are always on their feet. For runners, the most common type of injuries target the knees, legs, and feet. According to Kokoris, typically 50% of runners experience an injury each year that prevents them from running for a period of time, and 25% of runners are injured at any given time. About 70 to 80% of running disorders are due to overuse of injuries, mainly involving the knee, ankle, foot, and shank atomic sites. Some of the most common musculoskeletal injuries related to running include patellofemoral pain, Achilles tendinopathy, medial tibial stress syndrome, plantar fasciitis, and the list goes on. The most frequent injury that runners tend to experience are patellofemoral pain syndrome, while medial tibial stress syndrome is the most
common. So I will be covering some of these typical approaches that we have on most overuse injuries, and furthermore, just common prevention strategies. So as Jeremy said, one of the more common injuries related to running is patellofemoral pain. And while there's a lot of approaches towards this, there's a few that tend to be used a little bit more frequently and with greater success by clinicians. So first and foremost, we want to have exercises that focus on strengthening the lower body as a whole. So not just the knee complex, but also the lumbopelvic region and the ankle. Just really focus on balance and strengthening those regions so they're sturdier to prevent injury and just to recover in case you are taken out of competition. Secondly, just using different joint mobilization and soft tissue mobilization techniques. So a adjustment is actually the highest grade of a joint mobilization, but in lower grade usage, you can just put motion back into those joints. So specifically the knee joint, Mellinger actually found that specifically focusing on the knee joint instead of the lumbopelvic region and the ankle region when it comes to patellofemoral pain, just focusing on the region alone is better. So that's something that we can implement in our care plans. And then when you look into soft tissue mobilization, common techniques would be something like A-stem massage, myofascial release, trigger point compression, and all those things would work, and you can use them together just to bring some elasticity into your muscles and just keep them from being tight, which would just cause further problems in your patellofemoral region. Another common injury related to running would be tibial stress syndrome, which is also called shin splints. That's probably what you know it as. Prevention is the best thing you can do with shin splints because once you get them, it's kind of hard to deal with them. But there are strategies that we can take as clinicians to lessen that pain and get you back to full function. One study actually aimed to compare the effectiveness of 4 different modalities when treating shin splints, and they compared iontophoresis, which is delivering medication via electrical stimulation, phonophoresis, which is delivering medication via ultrasound, then straight ultrasound and cold massage. And they actually found that all 4 of these methods were equally useful and decreased perceived pain and also increased active range of motion in their athletes. So obviously, as you can see, there's a multitude of approaches a clinician can take in order to provide the best possible care for the patients and keep them in the best shape possible to perform at a high level. And along with this, these intervention strategies coupled alongside chiropractic adjustment could elevate an athlete into a bodily freedom and health that they have not known before.
Chiropractors are skilled professionals that perform manual adjustments to the neck and spine, which is utilized to ensure that your vertebrae is correctly aligned and balanced. While chiropractic therapy is often used to treat neck or back injuries, it also can prevent and provide long-term relief in your joints and surrounding muscles in your body. As you run, your body is being stressed with every stride. This results in muscle breakdown and an inflammatory response throughout the body. As the miles add up, the muscular tension continues to build and your central nervous system becomes more taxed. You're becoming more prone to injury with every stride. The main cause of injury in runners is due to the repetitive, forceful impacts on the ground, overtraining, and improper warm-up. Chiropractic can help these athletes by relieving their pain and helping them heal faster after injury. In addition, the key to having a high level of performance and decreased injury risk is the multi-level treatment protocol that involves manipulative therapy, restoration of defective biomechanics, strengthening of weakened muscle groups, and lastly, motor pattern re-recognition.
To conclude what my colleagues have been saying, our goal is not only to bring you back to the game fully recovered from your injury, but it's also to prevent future injuries and bring you back even stronger than you were before. We hope by reaching out to you today, you're able to see beneath the surface of chiropractic, ultimately realizing who we really are and what we're capable of, which is we want you to win the race of life. Have a great day.